You are lying in bed, eyes closed. The alarm has not gone off yet. To any outside observer, you are completely still, completely calm, completely at rest. And in one sense, that is true. Your body is still, your eyes are closed, your breathing is slow. But inside your chest, something is already happening. Something that began 45 minutes ago while you were still in deep sleep. Something that will reach its most dangerous peak in the 60 seconds after your eyes open. Something that has been responsible for more heart attacks, more strokes, and more sudden cardiac deaths between the hours of 6 and 10 in the morning than at any other time of the entire 24-hour day. And the overwhelming majority of adults over 60 have no idea it is happening. What happens to your heart in the first 60 seconds after you wake up is not a minor physiological footnote. It is one of the most clinically significant cardiovascular events of your entire day. It involves 2 hormones, 3 simultaneous cardiovascular changes, and a specific vulnerability that increases with every decade after 50. And it is happening to you every single morning, whether you know about it or not. The difference between knowing and not knowing is not academic. It is practical. It is the difference between a morning routine that helps your heart manage this 60-second window and one that tips it toward catastrophe. It is the information that most cardiologists never get to share in a standard appointment because there is simply never enough time. My name is Dr. Favor Clinton. I have over 10 years of clinical experience, and I have watched this 60-second window claim patients who had every reason to believe they were managing their health well. Today, I am going to explain exactly what is happening inside your heart in that window, why it matters more after 60 than it ever did before, and what you can do about it starting tomorrow morning. Stay with me through every detail, because the biology is what makes the action meaningful. And the action itself takes less than 2 minutes. Let me take you through the 60-second window moment by moment, because the sequence matters as much as the individual components. While you sleep, your brain cycles through stages of sleep that include periods of deep, slow-wave sleep and lighter periods of rapid eye movement sleep. In the final hour or 2 before waking, the proportion of light sleep increases, and during this transition toward waking, approximately 45 to 60 minutes before your eyes open, your hypothalamus, the region of the brain that regulates your body's internal clock, begins signaling the adrenal glands to start producing cortisol. Cortisol is your primary waking hormone. Its job is to prepare your body for the demands of consciousness and activity. It raises blood glucose, it primes your immune system, and critically, it begins raising your blood pressure and your heart rate. This cortisol rise before waking is called the Cortisol Awakening Response, and it is one of the most powerful and rapid hormonal events in the entire 24-hour cycle. Simultaneously, your sympathetic nervous system, the branch responsible for the fight or flight response, begins activating. Adrenaline and noradrenaline start entering the bloodstream. Your heart rate begins climbing. Your blood vessels begin constricting. By the time your alarm sounds and your eyes open, your heart rate has already increased significantly from its overnight resting level. Your blood pressure is rising, your blood vessels are narrowing, and your blood, which has been sitting without incoming fluid for 7 or 8 hours, is at its thickest and most viscous of the entire day. This is the state of your cardiovascular system in the 60 seconds after waking. Not calm, not resting, already surging, already stressed. Already navigating a hormonal wave that would challenge any cardiovascular system, and that, after 60, challenges it more than at any previous decade of life. Now add one more variable: plaque. Research estimates that by the age of 65, a majority of adults have some degree of atherosclerotic plaque in their arterial walls. Much of it is stable. Much of it will never cause a problem. But the morning pressure surge, the sudden constriction of blood vessels, the increased blood viscosity and clotting factor activity, these are precisely the conditions under which vulnerable plaque cracks. A cracked plaque triggers clot formation. A clot in a coronary artery is a heart attack. A clot in a cerebral artery is a stroke. That is not a theoretical sequence. That is the mechanism. That is what the 60-second window can initiate. And that is why understanding it is not optional for anyone over 60 who wants to protect their heart. I want to tell you about a patient I will call Reginald. Reginald was 66 years old when I met him in cardiac rehabilitation, 3 weeks after surviving a myocardial infarction, a heart attack, that had occurred at 7:40 in the morning on a Wednesday. Reginald was not a man anyone would have identified as a high cardiac risk. He was slim. He did not smoke. He had managed borderline high blood pressure for 4 years with a single low-dose medication that his GP described as precautionary. He walked his dog every morning. He ate a Mediterranean-style diet because his wife had read about its benefits and had implemented it in their household with quiet determination over the preceding 2 years. He told me, in the careful and analytical way of a man who had spent 30 years as a quantity surveyor, exactly what had happened that Wednesday morning. His alarm went off at 7:15. He reached over, silenced it, and sat up immediately. He swung his legs to the floor. He stood. He felt momentarily dizzy, which he had been experiencing most mornings for several months and had attributed to dehydration. He steadied himself against the bedside table and walked to the bathroom. He was washing his hands when the chest pain began. When I reviewed his timeline with the cardiology team, the sequence was consistent with what we see repeatedly in morning cardiac events: the alarm, the immediate upright movement, the orthostatic blood pressure drop, the compensatory cardiac surge to restore circulation, the surging cortisol and adrenaline wave meeting a cardiovascular system already under maximum morning stress, a vulnerable plaque, undetected, in the left anterior descending artery, cracking under the combined pressure. Reginald survived. He is alive and well. But the question he asked me in our first rehabilitation session has stayed with me for years. He said, "Is there anything I could have done differently that morning that might have changed what happened?" I told him honestly that we cannot know with certainty, but I told him what I am going to tell you now. There are specific things that either protect the cardiovascular system during that 60-second window or amplify its vulnerability, and knowing the difference matters. The morning waking period produces 3 cardiovascular changes simultaneously, and it is the combination of all 3 arriving at the same moment that creates the danger. Understanding each one individually is important. Understanding why they arrive together is what makes the 60-second window uniquely significant. The first change is the blood pressure surge. Cortisol and adrenaline drive blood pressure upward rapidly in the minutes around waking. Studies using 24-hour ambulatory blood pressure monitoring have documented the steepness of this rise. In some individuals, systolic blood pressure can increase by 30 or 40 points within the first 30 minutes of waking. In adults with stiff, less elastic arteries, this sudden pressure increase is more abrupt and more mechanically stressful to the arterial wall than it was in younger, more elastic vessels. The second change is blood vessel constriction. Adrenaline causes vasoconstriction, the narrowing of blood vessels throughout the body. Narrower vessels mean higher resistance. Higher resistance means the heart must work harder to push blood through them. In a cardiovascular system that is already managing the pressure surge from change 1, the added resistance from change 2 compounds the workload in a way that can exceed the heart's comfortable operating capacity during those first minutes. The third change is increased blood clotting activity. Research has consistently documented that platelet aggregation, the tendency of blood platelets to clump together and form clots, reaches its highest activity level in the early morning hours. This is not random. It is a vestigial biological mechanism from a time when the transition from sleep to wakefulness carried genuine physical danger that might require rapid clot formation to manage injuries. But in a modern body over 60, with atherosclerotic plaque in the arterial walls and cortisol-driven blood pressure surging through narrowed vessels, this peak clotting activity is a liability rather than a protective feature. These 3 changes, pressure surge, vasoconstriction, and peak clotting activity, arrive together in the 60-second window around waking. They are not sequential, they are simultaneous. And that simultaneity is what makes the 60-second window the most dangerous cardiovascular moment of the entire day. Everything I have described so far also happens to a 40-year-old. The cortisol surge, the adrenaline, the vasoconstriction, the clotting activity peak. So why is this window specifically more dangerous after 60? There are 5 compounding factors that accumulate with age and that each independently increase the danger of the 60-second window. Together, they create a cardiovascular environment in an older adult that is qualitatively different from what a younger person faces during the same morning surge. Factor 1 is arterial stiffness. Arteries become progressively stiffer with age due to changes in the elastin and collagen content of the arterial wall. A stiff artery cannot expand and absorb the morning pressure surge the way a young, elastic artery can. It transmits the full force of that surge to every branch and vessel it supplies, including the small vessels of the heart and the brain. Factor 2 is plaque burden. The likelihood of having atherosclerotic plaque in the arterial walls increases with every decade of life. Most of that plaque is stable, but some of it is vulnerable, with thin, fibrous caps that can crack under the mechanical stress of the morning pressure surge. The older the patient, the higher the statistical likelihood of having at least some vulnerable plaque present. Factor 3 is reduced baroreflex sensitivity. The baroreflex is the body's automatic blood pressure regulation system. When pressure rises too quickly, the baroreflex normally activates to dampen the surge. After 60, baroreflex sensitivity measurably declines. The dampening mechanism is less effective. The morning pressure surge rises higher and more steeply before the body's regulation catches up. Factor 4 is overnight dehydration. As discussed in previous videos, blood viscosity is at its highest in the morning after overnight fluid loss. Thicker blood is harder to pump, places higher demand on the heart, and is more prone to clot formation when the platelet aggregation peak is already elevated. Factor 5 is medication timing. Many blood pressure medications taken the previous evening have partially worn off by the time the morning surge arrives. This creates a window of reduced pharmaceutical protection, precisely when cardiovascular demand is at its peak. This is a recognized clinical issue in hypertension management, and one worth discussing specifically with your physician. Understanding the danger of the 60-second window is only useful if it leads to something protective. Here is what the research supports and what I recommend to every patient over 60 who wants to give their heart the best possible support during this critical transition. The first protective action is the one that requires the least effort and delivers the most immediate cardiovascular benefit. Before you sit up, before you move at all, take 5 to 10 slow, deliberate breaths. In through the nose for a count of 4. Out through the mouth for a count of 6 or 8. The extended exhalation activates the vagus nerve and the parasympathetic nervous system, which directly counteracts the sympathetic surge of cortisol and adrenaline. Research on slow breathing upon waking has found measurable reductions in the steepness of the morning blood pressure surge in adults who practice it consistently. It takes 60 to 90 seconds. It costs nothing, and it intervenes at the precise biological moment when intervention is most meaningful. The second protective action is the gradual transition from lying to standing. Do not sit up immediately. Roll to your side first. Push yourself slowly to sitting. Sit on the edge of the bed for a full 30 seconds before standing. Rotate your ankles to activate the calf muscle pump. Then stand slowly and hold still for 10 seconds before taking your first step. This sequence prevents the orthostatic blood pressure drop that forces the heart into a compensatory surge on top of the cortisol surge already in progress. The combined cardiovascular burden of both surges arriving simultaneously is precisely the mechanism that precipitated Reginald's cardiac event. The third protective action is hydration before anything else. A glass of water at room temperature, consumed before coffee, before medications, before any other fluid or food, begins reducing blood viscosity within minutes. It reduces the clotting risk that is elevated during the morning platelet aggregation peak. It gives the kidneys and the cardiovascular system the fluid they need to begin managing the morning surge from a position of adequate hydration rather than overnight deficit. The fourth protective action is a conversation with your physician about your specific medication timing. If you are taking blood pressure medication in the evening, ask whether the coverage it provides extends adequately through the morning surge window, or whether a timing adjustment might provide better protection during the highest risk period of the day. This is a clinically recognized issue, and your physician should be able to give you a specific answer based on which medication you are taking and your individual blood pressure profile. Let me bring this into a single, clear, actionable sequence that you can implement tomorrow morning without any equipment, any cost, or any preparation beyond reading this to the end and remembering it. When your alarm goes off, or when you first become conscious of waking, do not move. Stay exactly where you are. Take 10 slow, deliberate breaths, in for 4, out for 6 or 8. Feel your heart rate respond to the parasympathetic activation. This is your 60-second intervention. This is the action that begins counteracting the cortisol surge before it reaches its peak. After the breathing, roll to your side. Take your time. Push yourself to sitting on the edge of the bed. Sit still for 30 seconds. Rotate your ankles in slow circles, 5 times in each direction. Then stand slowly. Hold still for 10 seconds. Walk to your water glass, which you have placed on the bedside table the night before. Drink the full glass before anything else. Do not check your phone for the first 10 minutes. Let your nervous system complete its transition from sleep to waking before you expose it to information and stimulation. Take your blood pressure medication, if prescribed, with food and water rather than on an empty, dehydrated stomach, and speak with your physician about whether your current medication timing provides adequate protection through the morning surge window. That is the protocol. Breathing, gradual rising, water, quiet 10 minutes, medication with food. It takes less than 15 minutes, and it gives your heart the most important gift you can offer it every single morning. The gift of a managed transition through the 60-second window that is the most cardiovascularly dangerous moment of your day. The first 60 seconds after you wake up involve 3 simultaneous cardiovascular changes: a blood pressure surge driven by cortisol and adrenaline, vasoconstriction that increases cardiac workload, and peak platelet aggregation that amplifies clotting risk. These changes happen every morning to every adult. After 60, they happen in a cardiovascular environment that is less equipped to manage them due to arterial stiffness, plaque burden, reduced baroreflex sensitivity, overnight dehydration, and potential medication timing gaps. This is why heart attacks cluster so heavily in the 6 to 10 in the morning window, not because of coincidence, because of biology. Biology that is well understood, well documented, and almost never discussed in the 15 minutes that a standard medical appointment provides. Reginald asked me whether anything could have changed what happened to him that Wednesday morning. I told him we cannot know, but I told him that what he does every morning from that point forward can give his heart the best possible chance in every 60-second window that remains. He took that seriously. I hope you will too. I want to hear from you in the comments right now. Were you aware that your heart was already surging before your eyes even opened? And has any cardiologist or doctor ever explained the morning blood pressure surge to you in a clinical appointment? Those 2 questions tell me more about the gap between what the research shows and what patients are actually being told than any other data I have access to. Your answer matters. And if this video gave you something genuinely important today, please share it. Share it with the people in your life over 60 who wake up every morning and immediately stand up, immediately reach for their coffee, and have no idea what is happening inside their cardiovascular system in those first 60 seconds. Subscribe for more honest, research-grounded conversations about protecting your heart after 60. Next time, we are going to talk about 8 warning signs that your heart is under silent stress. Signs that appear in the spaces between clinical appointments and are missed precisely because no one has explained how to recognize them. That is a video you will want to see before your next medical checkup.